Nakitlong ka Ri Khasi. Ngiwan lam siya pi ko sngur bakhuit parpasngam. Ka beats aqua. Shpausnem dang yai pinja sliang.
Got your results? Looking for a new course in nursing and paramedical course? Admission open at one of the topmost colleges in the country, East-West Group of Institution Bangalore, recognized by Indian Nursing Council and Rajiv Gandhi University of Health Science. Choose your courses on your screen. Hurry up, limited seats available. For more details, you can contact the link given below.
We have another doctor joining us here today, Dr. Arindam Mondal, a medical health professional. He is an HOD and senior consultant and surgical oncology at Manipal Hospital's EM Bypass. So doctor, we are very glad to have you here with us. And before moving forward, can you please give us your introduction?
Yeah. Hello, I am Dr. Arindam Mondal. I am a surgical oncologist by profession, which is basically cancer surgery. And I am a senior consultant at Manipal Hospital's EM Bypass, which is in Calcutta.
Okay. All right, doctor. So we have quite a few questions for you. Okay, starting with the first question. With Meghalaya witnessing a rising focus on cancer awareness and early detection, what are some of the most common cancers you encounter? And what challenges do patients often face in seeking timely treatment?
Okay. So in my practice, I mainly deal with cancers of the chest and that of the abdomen. Mm-hmm. So like starting from the lungs, the esophagus, which is the food pipe, then stomach, colon, rectum, liver, pancreas, etc. So of these, if we see the most common of these ones, one is lung. Lung cancers are very prevalent, especially because of the habit of smoking. Also colorectal cancers, colon and rectum cancers. Okay. However, if we talk about Meghalaya, Meghalaya has a unusually high incidence of food pipe cancers, esophagus cancers, which is actually the highest in the country. Right. So it is not that high ranked in the rest of the country, but in Meghalaya, esophageal cancers are one of the most common. Regarding the symptoms which you are talking about, like what are the hindrances for them, for patients to get early treatment, basically, it is at some level awareness. Okay, and I'm very happy that you are doing this in order to spread that word, because what we do not know, we do not seek help for. So as long as I do not know what I'm having might be something dangerous, I will keep thinking that it is something which will just pass. Okay, like for example, if for food pipe cancers, the early symptoms will be like if you're not able to swallow food properly. You're taking some dry food and it is not going very well. You have to take a gulp of water, then only it is going down. So those can be the very early symptoms of a food pipe cancer, which can progress to a point where you are not even able to drink water. Even that is coming out. So we do not want the tumor to go till that stage. So the earlier we find it, the better. So one is not knowing about what to report. The other thing, many a times in our population we see, because going to the hospital, going to meet a doctor will affect the routine, the daily work, be it the daily wage earners, and also they fear that they're like, we'll go next week, and that gradually takes months, and then the diagnosis gets delayed. Logistics might be one thing, and the facilities, so where to go exactly. So knowledge about that is very important in our society.
Okay, at least so viewers, as you have heard, the earlier the better, again, because the earlier you find out about the diagnosis about in your body, the better the treatment would be.
Yes.
Okay. So moving on, doctor, to the second question. Surgical oncology has evolved significantly over the years. How have advancements in technology and surgical techniques transformed cancer treatments and patient recovery?
First, why surgery? So if we take cancers, most of the solid organ cancers, so this is broadly classified into blood cancers, for example, and the solid organ tumors like breast cancer. All of these cancers we are talking about: breast, lung, esophagus, stomach, any of these cancers, the majority of them, the treatment of choice is with surgery. We have to remove that segment of the cancer and join the things together again. So, but it may not be the only treatment. We might require chemotherapy and radiotherapy along with it. But on maybe more than 90% of these cancers, surgery is the mainstay of treatment for curative treatment. But then, any cancer, the treatment is completely decided based on the stage. So, a cancer which is detected in the early stages, like stage 1 or 2, the chances of it getting completely cured with the treatment and for it to not come back, the chances become higher. On the same scale, if it becomes like stage 3 or so, then even though the cure is possible, chances of recurrence of the cancer are higher. And if it is stage 4, which is basically spread to other parts of the body, then we might not even do surgery. It is only, the treatment is to extend life rather than to give complete cure. So the timing does matter a lot. So, and in that since surgery plays such an important role, of course, the next question comes, like, people are very scared of surgery many times. Sometimes it is about the anesthesia, because most of these are major surgeries, takes a few hours, and the patients are under complete general anesthesia. They don't know a thing actually, they're unconscious, but you fear that, like, what if I don't wake up or something like that. Many of our patients do ask, but in that aspect I would like to say, first of all, anesthesia has not been ever safer. So even the technology which we have even today, say 30 years back, it is so different and it is so safe now that even patients in their 80s and all getting major cancer surgeries and doing very well in the post-operative period is a routine thing. Now coming to surgery per se, the same surgeries which used to be done only with open technique, for example, you cut open and then you see inside and do, has transformed to something called minimally invasive surgery, where we do surgeries using a laparoscope or a robot. So laparoscopic surgeries or robotic surgeries have had a paradigm shift in the treatment of surgical treatment of cancers, because with this we have much lesser blood loss, for example, during the surgery, much lesser pain after the surgery, and overall safety of the surgery becomes more. So the chances of complications after surgery, infections, etc., all of that reduces. Of course, scars are very minimal, so it's almost not seen, but that is an added benefit. But more importantly are these other factors which have made surgery so safe that fearing it in today's day does not make any sense. Of course, we do see whether patients are fit for a particular surgery or not. It's not like everyone walks in and we give a fit certificate, you go ahead with the surgery. So there is a lot of checks which happen before that. The anesthetists do see the patient and make sure that he's in a good enough position to undergo surgery. After that only surgeries are undertaken. So there are checks and you need not be afraid about it.
When we talk about surgery, it reminds me of my first surgery experience, which I was pretty enough very much afraid during that process. All right. Coming to the third question, doctor. Many patients fear surgery when diagnosed with cancer. How would you explain the role of surgery in cancer treatments and how can it contribute to better outcomes? I guess we have discussed this just now, right? Okay, so coming up to another question. Early detection plays a crucial role in cancer management. What symptoms or warning signs should people not ignore and consult a specialist about it?
That's a very important question basically, and what is important to know is that all cancers do not have same symptoms. There can be some symptoms which are common to many of the cancers, but many of these cancers depend upon where the cancer is arising. So suppose, for example, if it is an oral cavity cancer of someone who is a regular tobacco user, so you'll be able to see an ulcer in the mouth or in the tongue, which is relatively easier to diagnose because you do get to see something is wrong. But for example, breast cancers, those are again surface organs. You can see there might be a lump coming up. But then all these organs which are inside the body, the internal organs, like the food pipe, like the stomach, the gallbladder. These are do not give very early symptoms, for example, or these are very subtle symptoms which should not be ignored. Like I was telling about the food pipe cancers, where you might have just some difficulty in, you're able to have food, but it's just that it feels a little dry, that only with the water, or a little porridge or something is going well, but dry rice or something is not going. So those might be the early symptoms of food pipe cancers. Similarly, if there is any blood seen in the stools, or any dark colored stools, or if sometimes there is a vomit or a sputum coming out which shows blood, these can be red flag symptoms. It can be anything from an esophagus cancer to a stomach cancer, colon cancers, or lung cancers. Some of the common symptoms which I was telling, those can be just weakness, just lethargy. You don't feel as active as you were before, or you're losing weight. You don't feel like eating that much, loss of appetite, loss of weight. These can be some of the common symptoms of cancer. Because whenever there is a cancer building up inside the body, it usually tries to take away most of our nutrients which are going, and the body suffers at the because of a reason for this. So that is why the weight loss and everything comes up. So any of these things are there, it is definitely not the time to delay. Show to a consultant right away.
Okay, I have learned a lot from you, doctor. It is very, very interesting, because it makes me rethink about my health checkup as well right now, because it's been a long time since I've went to the doctor. All right, moving on to the next question. Head and neck, gastrointestinal, breast and other cancers often require a multidisciplinary approach. How important is collaboration between surgical, medical and radiation oncologists for effective cancer care?
Yes. So in today's day, cancer is, even if it is an esophagus cancer or something, it is not the forte of just the surgeons, so to say. Though surgery is the most important treatment in it, but over the so many decades, we have our medical research which has found the best possible cure for these cancers. And most of these cancers, they involve all the three major branches, all the three major pillars of treatment for cancer. Okay? That is, one is surgery, systemic therapy or chemotherapy, immunotherapy, and radiation therapy. So the examples which you said, along with that, even like food pipe cancer, rectum cancer, these are the ones which are ideally, actually, all the three branches come together. So it makes only sense that all the doctors who will be taking care of a patient sit together at the beginning of the treatment itself, knowing the stage, and decide, okay, this patient, it's better that he goes for chemotherapy, radiation first, reduces the tumor, then you go ahead with surgery, remove it, then gets more chemotherapy so that it doesn't come back. So that is usually, most of the cancers fall in this line. Although if it is an very early tumor, then it is better that we do away with radiation initially. We give surgery, we do surgery first and then decide other. So every cancer, as I was telling, it depends upon the stage. And that is why every individual patient needs to be decided by the team working together. And that is where comprehensive cancer care comes into the view, where we have all these branches practicing together in the same, under the same roof. So it becomes easy for us to come together, discuss a patient, and to have the patient under confidence. Okay, so this is how it will go, so that you have a roadmap. Many a times after the diagnosis of cancer, what happens is we feel like the floor is basically taken off from under your feet. So to give that sort of stability, I would say that, okay, this is what you have, this is what the stage is, and this is the plan. It's why you got it and all are unnecessary questions, but what to do next is important, and we have this roadmap in front of us that can happen with everyone working together. And yes, it is a very important part.
Yes, okay. All right, viewers, you don't have to be afraid. Doctors are here to help you. All right. Yes. Okay. Moving on. So, doctor, I have one personal question that I have to ask you. How painful are these treatments?
Okay. Depends.
Okay.
So, I'll tell two things. How painful are these treatments, and what happens if you don't treat.
Okay.
Okay. Because it's always we focus on one thing.
Okay.
So, like if we talk about surgery, in today's day, it is anesthesia is great, and the pain management after surgery is so good. One of the reasons is we are doing most of our surgeries by this either laparoscopy or robotic, so the actual scar, actual pain is not much. On top of that, the medicines that we have, the injections that we have, certain blocks which are there, that takes away the pain to a great extent. Like most of our patients after the day of surgery, the very next day they are made to walk inside the ICU quite a few times during the day. So that improves the rest of the recovery and all. So that can happen only when the person is pain free. So that is one. The other thing is the fear about chemotherapy. That okay, a lot of side effects, this and that, what will happen, will my hair go off? So those are valid questions. Not chemotherapy is an umbrella term. It does not include all the same treatment for all. So chemotherapy for lung cancer will be different from chemotherapy for stomach cancer. The medicines which are given inside are entirely different. So based on that, the side effect profile also changes. But we have to understand all of these are temporary. Be it the pain after surgery, it stays for 1 or 2 weeks. Be it the side effects of chemotherapy, it is given only in cycles. You take one now, one after 3 weeks, something like that. So your symptoms, they come down, they again, after giving the next cycle, it might come, and a few days, and then it goes off. And once the treatment gets over, everything stops, including all the hair which comes back. Okay, so these are reversible changes which go and come back. So many a times people are, ladies, like they are more concerned, like if my hair falls off. So those are valid concerns. But the bottom line is all of that comes back. But at the same time, we have gotten rid of the cancer. So now what if we don't treat? If we don't go by this way, then what happens? Okay, you will not have these temporary pains for sure, but the cancer increases. It does not stop because you have stopped treatment. And if it increases in size in the stage, pain is one of the most common symptoms in advanced cancer. So the same pain which you are trying to escape comes back to bite you. So that is why it is very important that you do not get afraid of these treatments, taking it on the stride that it is a temporary thing, and we will be seeing the light on the other side of the tunnel once the treatment is over.
Right. Okay. So you've heard it from Dr. Ryngdang himself. The pain is temporary. So moving on, doctor, to another question. What are some common misconceptions about cancer surgery that patients and families should be aware of?
Okay, one, I think even before surgery, I think doing a biopsy spreads the cancer. Okay, that is definitely no-go. There's no valid reasoning behind that. Of course, there are certain cancers in the early stages we do not prefer to do biopsies. For example, gallbladder cancers. But those are exceptions than the rule. Most of the times we need a biopsy to prove that it is cancer. That is one thing. Then about surgery, it's the same fear about surgery is also there. Like doing a surgery causes the cancer to come back sooner or for it to spread. That is not so. In fact, if your cancer has spread, we do not do surgery at all. Surgery is done only in the stages where it has not gone off limits, basically. So once the surgery is done, the entire thing is removed. It is curative. The pain, everything, as we were telling, is temporary. The patients do go through a lot of checks to make sure that the patient is fit. Every patient is different. A patient who comes in his 60s with the esophageal cancer, early stage and fit looking patient versus someone who is in his 80s coming on a wheelchair, of course might not be fit for surgery. We might think about other sorts of treatment like radiation therapy, etc. But then thinking that, okay, if he is old age, then there is no treatment and keeping them at home may not be the best strategy. So let the people who are experts in this decide. And of course, if it is something which has a significant risk to life, then we of course tell our patients about that and make sure that they are on the same page also. This decision of be it surgery, chemotherapy, whatever, it is not a one-sided decision which is basically put on the patients from the doctors. It is a joint decision which is taken along with the patient and the relatives in being inside the group, basically, to decide together.
Okay. Lifestyle factors such as tobacco use, alcohol consumption, and dietary habits are linked to cancer risk. What preventive measures can people adopt to reduce their chances of developing cancer?
Okay, stop them. That will be the simple answer.
Yes.
But that's not just that. So yes, we do know this addictions especially tobacco in any form, be it tobacco by chewing, tobacco by smoke, wherever it goes, it causes cancer basically. You see the mouth, the spit, if you take in through the esophagus, food pipe, then the smoke goes to the lungs, goes to the stomach, then it is flushed out of the body through the kidneys. All of these organs, the cancers are related to smoke, to tobacco. And so many others actually. So complete cessation of tobacco in any form is a very important step. Alcohol consumption, to stop alcohol consumption is very important. Along with that, some things which are less addictive and more in our daily life, like our food habits. Okay, so if we see a lot of our diet has now become more of a Western diet with a lot of processed food coming in, a lot of salamis, sausages, etc. Processed meat has been found to directly cause certain types of cancers like colon cancer. We have a very high incidence of colon cancers in the US, probably because their meat consumption is mostly through processed meat, unlike ours, which we have more of fresh meat basically. So that is one thing that we have to keep in mind, that our dietary changes also here in Meghalaya, smoked meat. That is a delicacy, and I do not blame you for that because it's tasty too. But then that does have a correlation with certain cancers, especially esophageal cancer. So moderation in these things is very important. And as far as we are limiting these things, there are certain things we have to improve also. That is the other side, which is improving your diet, like including more of vegetables, more of fruits in your diet, and activity. So given most of our jobs now, it is mostly sedentary lifestyle, desk jobs basically. We are not physically that much active. So it is very important that we are spending time in taking care of our bodies by exercising. You need not be going to the gym every day, but at least walking an hour or so, trying to walk an hour or be physically active. So that has been multiple studies have shown that those things do reduce the chance of developing changes in our genes, malignancies, cancers coming up in the later. So yeah, those are the common things which we can do to inculcate healthy habits against cancer.
That's quite interesting to know, Doctor. Yes, because an active lifestyle is also very necessary.
Of course, not just from the cancer point of view, but also from your heart health, because all this huge epidemic of cardiac diseases happening, myocardial infarction, etc., strokes happening. Those are also the things which will be similarly benefited with these things.
Right. Okay, Doctor. So we have one last question for you, Doctor, sadly. All right. So the question is, for patients in Meghalaya and the Northeast who require specialized cancer treatment, what message would you like to share about the importance of consulting experts and seeking care at the right time?
Okay. I think I'll reiterate what I previously said. That, I'll give you a scary epidemiological data. In India, the overall, what is the risk of someone getting cancer, if someone asks. So that is 1 in 9 people in the country will get cancer during their lifetime. That is from the data which we have. So basically, if there are 9 people sitting in a room, 1 of them will get cancer during their entire life. The same number is 1 in 5 here in Meghalaya. So 1 in every 5 people right now gets cancer in the state. And that is what we have from the data from the past years. So that is a very, very high number.
It is.
So it is very important that, one, you take care of your bodies. And secondly, if any of these symptoms which we discussed about today, if you notice any of this, these might be very, very small for you to bother also. Just a vague pain in the abdomen, or just you're not feeling very well for some time, 2-3 weeks or so, you're feeling weak, you're losing weight, but please go to the doctor. If at all, what can happen, it might not be cancer. You go in, get a checkup, and everything is clean, you come back, that is fine, you have peace of mind. If it is cancer, we would have diagnosed it at an early stage and given you complete recovery from the cancer. And that time matters. In cancer, everything is about the timing. Even a month's loss, you are letting the cancer grow. So any of the symptoms, right away, show to some doctor. That will be my advice.
Okay. All right, Doctor. Some parts of it does sound scary, but I know there is a ray of hope, a ray of light in there with doctors like you that we have around us, like I'm pretty sure that it is curable.
Yes, of
It
course.
is, it
When we are
is,
inside a tunnel, it looks scary.
It does.
But when we walk out through the other end, we see the daylight again.
Yes,
So, yeah.
yes, doctor. All right, doctor. Thank you so much,
Thank you so much for
being
having-
here with us. Thank you so much for this discussion. It has really been an honor to have you here. We are very glad,
Likewise.
doctor. Thank you so much, doctor.
Lily, Pikalan.
Kanda pitharai kami ka bisa. Paling itu na hadu kami.
Kenambay kami kami.
Mano bawan kata baci.
Lawan ilalang Kumno.
Ila kham stom menta.
Bila su palan. Wan num dan jing tiang ni ai. Menta tu penhiar mensiam suki-suki bat ngamo.
Kali jong na kani. Ba, ka hospital te kala ajkai nang ni. Kabai kali pan.
Kabai kali latip ke sarkar.
Binti aswa hang ni hadu nda de por khamo.
Wat ko selaitan.
Ba kan dekat skim kalaya rap cibun ya kelong yeng kum chong pi.
Shim kanay ka bam. Kublay shibun sista. Ngiran ka man siwi ay.
Em perok kala hika sarkar.
Kublay shibun. Iladan ako siya kakababyang.
Ke sarkar ka ajarap ikit kiba aplang.
Kublay shibun.
Sister, hapsi ukat no ma.
Kasurkar kala siulat ikijing lut jing separo.
Kablay sipuan ma.
Ngiki bakar do ngampu iperkan banyo kum kani kajing yarap. Hawat kan?
Kani ka Chief Minister Safe Motherhood Scheme. Kala ajing rap yang isibon bah kipat ba.